Hi everyone, this is Shalu Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. In today's video, I will be going through one of your other clinical skill, which is taking catheter specimen of urine. Okay, so if you like my videos, please press the like button now and subscribe to my channel. It keeps me motivated to make some more lovely videos for you, so hopefully they are helping you in preparing for your OSCE exam. And also feel welcome to leave any messages, or I know you've been sending messages through WhatsApp and my website, but also interact with me. You can add the comments to this video. If you have any question, please go ahead and ask. Okay, so in today's video we're going to be covering how to collect a catheter specimen of urine in your OSCE test center, what kind of briefing you will get from your examiner, what you need to do, and of course my top tips. Okay, so let's talk about catheter specimen of urine. So why do we collect it? We collect it for culture and sensitivity. It means we need to see if the patient is having any urinary tract infection. Okay, so we check that, and obviously sensitivity part of it tells us what kind of antibiotics we can give to our patient depending on what kind of urinary infection your patient has. So it is an 8-minute station in your exam. So you'll be collecting catheter specimen of urine. You may be given a pathology form, you may not be given a pathology form. There is one on the test center website, so you can have a look at it, but all test centers don't give one, and so that will be, if you're given one, just work with that form. And then also in your briefing, your examiner tell you that you need to collect a catheter specimen of urine at this time, what is your patient scenario quickly verbally, and also tells you that your tray or trolley is clean, ready to use, and your ID check has already been completed. So those are your pre-checks which are already been done. Okay, so now you just need to simply go ahead and collect the specimen using aseptic non-touch technique, because we want to keep this specimen as sterile as possible, and then finish your station. So let's get into what we need to do for this station. Also, the pot you've been given to collect your sample is always pre-labeled. Okay, so they have already labeled it with patient details for you. You can, if they give you any paperwork, you can check against it to make sure it belongs to the same patient. Okay, so on your next slide, you can see I have put a picture of a catheter and shown you the port from where you need to take the sample. Of course, the other port is for inflating the catheter, which is the balloon port, and the one with specimen port on it is very clear, so I've labeled that for you. And obviously you will need a 10 ml syringe, you will need your apron and gloves, you will need your sterile pot to collect the specimen, and you will also probably need a clamp. In some test centers they already clamp the catheter for you, in other test center you will have to clamp it yourself. Okay, so like any station, you need to make sure you do the scene safety, clean your, obviously draw the curtain, clean your hand, fully explain the procedure to the patient, gain the consent. If the ID check has already been done, you can skip that and just say ID check has been already done as per my briefing, and then you're going to go ahead, explain what you're going to do to your patient, take the informed consent, and then obviously you're going to make sure you have all your equipment, you have checked the dates of expiry on all your consumables. Then you're going to clean your hand, you're going to wear apron and gloves, and then you are, if your catheter tubing is already not clamped, you will clamp the tubing. Okay, once you have clamped the tubing, and if it's already clamped for you, then you're going to obviously clean the port using one swipe motion. That's your specimen port from where you're going to collect the specimen. You're going to clean it with alcohol wipe with 2% chlorhexidine. You're going to clean it from top to bottom in one swipe motion for 30 seconds and let it dry for 30 seconds. Once you have done that, you're going to open your syringe. Make sure you do not touch the key parts of the syringe, because we need to keep this sample sterile. So you will just not touch the front of the syringe at all. Okay, and then you're going to insert the syringe into your port. in your exam usually given needleless port. Okay, so you will not need to use a needle, so you will go straight into your port, and then you're going to collect about 10 mils of your sample. You're going to transfer aseptically. It means not touching anywhere outside of your bottle, and also inside. Just make sure you put the bottle on the table, and then you pour your urine into collected sample into the bottle without touching anywhere. Okay, so and then you close the lid, and then you say you will send this to lab as soon as possible. And all after that, if they given you another wipe, you can clean the port again one more time, and make sure you take the clamp off at the end. Okay, so that's really important. And then you're going to take your gloves off, clean your hand, take your apron off, clean your hand, make sure you make your patient comfortable, and then you verbalize that you will write everything in patient notes. And then they don't ask you to do any documentation in this station, just verbalize that you will document everything in patient notes, and then do your final hand hygiene. So that's kind of how you need to, the flow of the station, how you need to complete adapt to your test center. If they say ID check has been done, you can skip it. If it hasn't been done, you need to do it. If they have said the catheter is already clamped, then it's fine. If not, then you would need to clamp it. So those are the just little adjustments you will have to do according to your test center. So now my top tips for this station. So the first top tip is make sure that your technique of cleaning the port is correct. Okay, so you're going to clean it in one swipe motion. You're not going to go backwards on yourself. So once you clean it with one swipe motion for 30 seconds, let it dry for 30 seconds. Okay, so please then don't put your gloved hand or anything on it again, because then you will contaminate the port again. Other top tip is the thing is that you obviously don't touch the key part of the syringe, which is the front of the syringe, at any point, because that will contaminate your sample. Third one is listen to the briefing from your examiner. Like I said, there might be some pre-checks already done, so make sure you listen to it and you bring that in your station. That will save you time. If they're already saying to you ID check has been done, there is no need to repeat it. You can still go ahead and check the allergies with the patient if they haven't told you already, but then you don't need to do the ID check again if it's already been completed, and that's your briefing from your examiner. Another one is that make sure you take the clamp off at the end. Okay, this is a very common fail in this station. Because if you don't take the clamp off, you're leaving your patient into urinary distension. Okay, so we can't do that. So make sure, this is very common fail, that you take the clamp off at the end. And the last one will be make sure you're wearing gloves and apron. Okay, before you touch any tubing or catheter or anything, make sure you have your personal protective equipment on, which is your gloves and apron. So that's really, really important from infection control point of view. So these were my 5 top tips for this station. I hope you like the station. I hope you like the video. Please press the like button now and subscribe to my channel. I will soon be back with another clinical skills for you for your NMC OSCE exam. And please go ahead and visit us on oscetraining.com, and I will see you very soon. Bye for now.